Thank you so much for joining this session. I personally am really excited for this. I think this is going to be a really incredible opportunity to hear about when to refer to mental health professionals. So this session will be given by Wendy Matos, who is a full-time professional school counselor at a middle school, holds her MS in counseling, and is a registered associate marriage and family therapist in the San Francisco Bay Area. She is a major advocate for normalizing mental health counseling as healthy practice for all individuals, couples, and families as they grow through this world. So incredible resource today, incredibly important topic. I'm so happy to be here with Wendy, and I'm grateful that she's going to be sharing with us today. So please give her a huge round of applause. And if you have any questions, send them to me and we'll have them for her afterwards. So welcome, Wendy.
Thank you so much. That was really, really nice, a nice introduction. And I'm very grateful to have this opportunity. I think this is a topic that is very personal to me, but also that I wanted to bring to this group because I think there's a lot that we can start using and utilizing within our communities to support the individuals that we are supporting. And so since it is kind of a small group, I am also excited about just maybe in a little bit hearing from each one of you and hearing what you're hoping to get from this time, because there's a lot of different directions we could go in. So I want to make sure that it's useful to you, and that if you have specific questions as I'm talking, feel free to put them in the chat, and then we can kind of discuss them as we're going along. So for now, I'm just going to share my screen, and give me 1 second. Okay, so pick this topic, beyond my scope, when and how to refer individuals, couples, and families for additional support. Again, my background is in counseling. I'm I'm associate marriage and family therapist in the state of California.
Sorry, Wendy, could you maybe get a little closer to your mic?
Okay.
A little bit quiet.
Sure, thank you. So is that better?
Yes.
Okay. So I have my master's in counseling. I also have my associate marriage and family therapist degree, or I'm a registered associate marriage and family therapist in the state of California. And I'm this close to getting my license. I have about 100 more hours left to go before I'm a licensed marriage and family therapist. And currently I do work in a middle school. And I have worked with young people for 6 years in the role of school counseling, and doing a lot of advocacy and helping families connect to outside supports and services. So we do some screening and seeing when there's a need, and then helping families get that support, because that can be a really big challenge. So that's a little bit about me. And I think we have a pretty diverse group in the room. And so I imagine that some of you are pastors, youth leaders, mentors, facilitators, BFM volunteers, a lot of different hats. And we do a lot of different things in those roles. But some of those things that I imagine that each of you are doing in some ways is that you actively listen, you work to create safe spaces for those that you support. You encourage spiritual, personal growth. You're modeling communication skills and strategies. You share your wisdom and your experience over the years. You can help mediate difficult conversations, and then just a lot of other things that you do. So I do want to take a couple of minutes and just maybe in the chat, just hear from, and let's see, I don't see my chat. I don't know how to open it. Let's see. Okay, here it is. So if we can just share in the chat your role, and then what is something that interested you about this topic, or that you're hoping to learn more about. Okay. So I'm seeing the word stigma, and how to reduce the stigma, make people feel comfortable, specific steps that someone can take, to support someone with mental health challenges. Working with someone or understanding someone who is working with a counselor. All right, great. Okay, and I will try to just kind of keep the chat in mind as I'm going along, and that way, okay, I see more entries here. Okay, so support with addiction. This topic might be a new topic for maybe our church platform, talking more openly. Okay. And having personal experience and having family members and close friends, knowing that we see this need and we're not sure how to help. Okay, great. Well, I think that really gives me a good idea, and also that is what this topic is about. So I'm glad that you're here. And so let's, again, I'm going to try to keep my eyes on the chat as well, but if there's a question, I think, can everyone unmute? Are they able to unmute themselves if they have a question, Brianna?
Yes, yeah, they should be able to.
Okay, great. Okay, so if I don't see your question, please, you can also interrupt me because it is a smaller group. Okay, so let's just jump right into the topic of when to recommend professional help. We just talked about all of the roles that we play, that we are there to support our community, to listen, create a safe space. And sometimes the need is greater than that. Sometimes the need is more. And here's some examples of when we can still continue to support, but we can also be thinking about this might be a time that I can help link or refer to more support. So stuck individuals, you're working with an individual who still seems to not be able to shake some negative, and I'm going to go into different types of supports in a few slides, but someone you're trying to help, they have goals, but they're not able to make progress with those goals. They continue to repeat the same, maybe destructive or negative patterns, and they're starting to feel helpless or hopeless. And same with couples who don't seem to be able to have healthy communication. With I like to think of couples counseling as a little bit of a different approach or need than individual, because in a lot of ways, couples counseling and getting help can be preventative of larger issues down the line. And so, for different stages in a relationship, I think seeking professional help is honestly usually a positive. The earlier, the better. Also, mental illness and crisis. And we're going to talk a little bit about what defines mental illness and how do you know when there's that need. And crisis meaning even situations where someone is self-harming, or talking about suicide, or feeling completely hopeless and not sure what to do. Unhealed trauma. So we all carry different wounds from our past, and sometimes when we don't heal or work through or process some of those experiences, they show up in different ways. They show up in our relationships. They show up in our feelings about ourselves. And so if we have a past where there was trauma, and it doesn't have to be necessarily some huge event, but something that we never were able to really process and move away from or heal, then that might be something that someone needs to work with a professional on. With domestic and partner abuse, this is something that we definitely want to be referring out and getting, encouraging the individuals involved to seek more support, because it could lead to something really dangerous. It is a dangerous situation, or it can be if there's no outside support. And typically with that type of situation, counseling is not recommended, couples counseling, but more individual until the abuse ends. And there's different types of domestic and partner abuse, not just physical. And I don't know if we have time or interest to go into that right now, but if that's a question that comes up later, we can definitely go over that. And then, of course, child abuse. I know some of you work with young people, and when you're hearing situations where someone is being hurt, that's not okay. We need to reach out. We don't want to just be protecting that or covering up those instances, but we need to make sure that people get help, because children are very vulnerable. So talking about mental illness, we need to really think about, this is not an uncommon situation, that 1 in 5 people in the United States suffer or have some type of mental illness where they would actually qualify for a diagnosis. That's a lot of people. You think about the families, the couples that you work with, that you support. We're not talking about something super rare. We see this a lot. Some of the more common ones are depression or anxiety disorders. And what it means is that it's to a level that it affects somebody's ability to work, to have a healthy relationship, and to enjoy their life. So it's not uncommon. You're going to run into it. If you start looking for it, you will find it. And 1 in 20 adults in the United States have a serious mental health condition. So it's, if we think about it from a physical standpoint, we think of, there's a lot of people who maybe have different physical disabilities. Those are visible. It's easier to see, but for 1 in 20 of the 1 in 20 individuals in the United States, it's very debilitating for them, or it can be if it's not treated. And then 17% of youth experience health disorders, so mental health disorders. So it's not just adults, but that young people, especially now, and I can tell you this, working in a middle school with 11, 12-year-olds, that they are really, I see a lot of concerning things right now, especially with the pandemic. And I'm going to talk about that in a little bit too. So knowing that there are a lot of, it's not uncommon. So that just means that we should kind of always be screening in our mind when we work with individuals, when we work with couples, always think it's not out of the realm of possibility. And okay, maybe it's okay to ask some questions like, what are some indicators that there might be some type of mental illness? Feeling very sad or withdrawn for more than 2 weeks, trying to harm or end one's life or making plans to do so. Severe, out of control, risk-taking behavior that causes harm to self or others. Sudden, overwhelming fear for no reason, sometimes with a racing heart, physical discomfort or difficulty breathing, significant weight loss or gain, seeing, hearing, or believing things that aren't real, excessive use of alcohol or drugs, drastic changes in mood, behavior, personality, or sleeping habits, extreme difficulty concentrating or staying still, and intense worries or fears that get in the way of daily activities. So you might be even thinking, oh, I have some of these. Sometimes I feel this way, right? Sometimes I feel very sad or withdrawn, and I feel like my mood changes. And so we just kind of are keeping an eye on knowing these are indicators, and really, when it becomes concerning is when these are maybe happening at the same time, that someone is, if it's affecting them, that they, to the point where they are unable to maybe motivate themselves to get to work. They don't feel motivated to work on their relationship. They feel like they're checking out, they're withdrawing. And so they're not showing up to work. They're not showing up to family gatherings. And so those are times when you're going to be kind of looking out for, okay, maybe there's a need here. Um, like I said, this pandemic has taken a toll on our mental health by reducing the protective factors. There's a lot of things that help us have healthy mental health, like socializing, like going outside playing sports, going to church physically. There's things that help us to take care of ourselves mentally that we don't have, that we used to have and we haven't had for a year. And so I see this for the young people that I work with, just not going to school. In California and the Bay Area, schools have been closed, and I know it's been different depending on where you are, but and I have seen major increases in anxiety and depression in the students that I'm working with. And so I'm doing a lot of referring out. Increased financial stress, increased political stress, this polarization of the country, and increase in suicidal thoughts, especially of young people. And so we know that there are increases that we've seen with this pandemic, and that just means you're going to see that in the population, the community that you're supporting. And so it just means, okay, we need to be aware of those, look out for those even more, and try to focus on how to increase our protective factors. I wanted to talk about types of professional help because I think it's very confusing, and I work in the field, so and it can be confusing for me. But with mental illness, I kind of categorize two different types of professionals. There's those who can diagnose, and there's those who treat. So, and it's important to make that distinction because when we talk about barriers and insurance, this kind of helps create the pathway to getting that help. So medical doctors are usually trained to screen for our mental health. So maybe you'll see your general practitioner, a general doctor, and they can screen for a mental health disorder like anxiety or depression, but they don't usually treat. They usually refer out to a psychologist or a therapist. And then a psychiatrist is a medical doctor, but they specifically are trained in medication, and they understand a lot more about different side effects of different medications when you're combining medications, and so they recommend if someone is taking medications that they work with a psychiatrist, because a general doctor is not going to know. They might prescribe, but they might not be the best to be prescribing. They're not as trained in the different chemicals working together. There's also something called a psychiatric nurse, and they're trained in prescribing as well. And so they can diagnose, and doctors can prescribe. Psychologists and therapists both diagnose and treat, but they cannot prescribe. And there's a lot of different, depending on which state you live in, there's going to be different titles. Licensed clinical social worker, licensed marriage and family therapist, licensed professional clinical counselor, clinical psychologist. But the main gist is that all these different roles, they can treat mental health. So they will provide therapeutic services for you. And so it doesn't really matter the type of title or initials as long as they're credentialed. So what does professional help do that, that will help you see why making a referral or supporting someone to get that help, you can know how it will actually help them? Well, there's, I think, 4 main types of therapy. There's individual, there's couples or marriage therapy or counseling, there's family therapy, and group therapy. And so individual therapy is recommended for those who maybe have a mental illness. It's to maybe if you're, say, for example, you have depression, then you can work with a therapist to figure out how to change some of your negative thinking patterns or challenge them. You learn about coping skills that work for you. You might do some homework, do some exercise, We talked about healing past traumas, so that you can really be more present and less reactive to events and situations around you. Starting practicing reducing your anxiety around specific situations. And so it's really the individual work. I think of it as like, we're perfecting our individual selves. This is the individual therapy. How do I become my best self, so that I can be the most present in my family? I can be present in my relationship with my partner. Couples therapy, like I said earlier, I think it's such a helpful tool. Not just, a lot of times people go as a last resort. There's already been so much hurt between a couple, and this is like, I'm doing this just to say we did it and we checked it off before we go to divorce or separation. And really what it can be is so much more than that. It can be connection, building closeness, exploring how you can really be present and there for your partner, working on communication skills, a safe place to talk about things that can be otherwise really sensitive or triggering. Maybe sexual intimacy can be a really difficult thing to talk about. And so couples therapy, I think of it as like this really safe room to practice and grow your relationship. And especially if you start there when you're in an okay place. So instead of in crisis where you're feeling so hurt and it becomes hard to open up. I'm seeing some questions about prescriptions and medications. If the patient is already taking prescriptions for a condition, are there ways to wean off from some medications? And definitely that is a conversation that's, when we talk about these different professionals, you have your goal of what you want. If somebody's goal is, I don't want to be on medication, then that's something that you talk with your psychiatrist about. How do I use it to stabilize myself right now? But my end goal is, how do I eventually stop using it? And some therapists can work with you on skills around that will help you. Like, for example, ADHD medication can help you focus, but you can also, there are skills that can help you focus without the medication and work on those. So it's not a one size fits all model. It's a conversation that is tailored to you, that you have with your therapist, with your provider, based on your goals. Define triggering for those who don't know. I'm sorry, I don't even know how I used it in a sentence, but triggering, we think of triggers as something that happens right now. Maybe somebody says something to you in a certain tone, and that reminds you of a previous relationship or how your dad used to talk to you, and it brings up feelings that are unresolved towards your dad. And so it's a trigger that is not based on something that's happening in the moment, but bringing you back and bringing those feelings back. And so that's one definition. So, but there's a lot of different definitions, and usually it just means something that happens in your environment that creates a chain reaction and a certain emotion that comes up for you. I'm just going to look at my time. Okay. Because I want to make sure we have time for Q&A at the end. So I might hold off on looking at the chat just for right now until we're at the end. So family therapy is it's such a cool tool too, because what you do working with a family therapist is they bring in all of the members of the family, and you try to work on maybe there's a way that we relate that's not working well, or that keeps ending up in tension. And so let's bring it up. Let's try to figure out what that pattern is. Let's try to change that dynamic. And maybe you feel like you want to improve your relationship with your child. You feel like they're not talking to you. Family therapy is a really great way to create that space again to do that do that work, and with a professional who can guide and make sure everybody feels heard. Group therapy is a great tool for if you are going through something that others are, you can get that support from and shared experience, feeling that connection that you're not alone in this. And so a lot of times for families who have a member who has a mental illness and untreated, and this family is having a hard time because they're trying to fix the problem, but the individual doesn't want to, then group might be a good support. And then lastly, medication. A supervisor I've worked with told me that medication is kind of like creating a space. If you're in crisis mode and you can't even stop, you're having panic attacks, or you're having suicidal thoughts that just won't stop, you're in crisis, you're at risk. What medication does is it gives you a place to work from, so that when you take the medication, you work with your psychiatrist, it helps you stabilize so that you you can actually get work now on skills that are going to help you to get out of that crisis situation. Because if you really are at risk, then I think stabilizing is a good word. If somebody's really rocky and they need immediate help, it can be a good tool. I see a really good question. Again, I'm so sorry. I want to try to go through more of this, but then I'm going to revisit these questions in the side. So when you're working with a mental health professional, all studies have always shown that the most important factor in how well your therapeutic relationship the outcome of your work with a therapist is based on your relationship with the therapist. It's not the style of counseling that they do. It's not their background necessarily, but it's whether you feel listened to, whether you feel like you trust them and you feel comfortable opening up. So it's really, there's a term called therapist shopping, where we say, don't just go with the first one that you find. You really need to find someone that you feel comfortable with, that you feel like you can open up to, because that's what you're going to be doing. It's an investment in a relationship. And sometimes we just go off of, oh, this person worked with them, so I'm going to try them. But everybody's different. And so what I recommend is, looking online, searching for different therapists, and then doing a phone consultation. Most of the time, they'll do a free phone call where you get to ask them questions and get a sense for who they are, how you connect with them, and then you would schedule your initial appointment. And if you don't feel good about them, you realize, I don't actually feel like I can talk to this person, don't stick with it, because that's another thing that a lot of people do is they say, oh yeah, I did therapy, I tried it, but I didn't really like my therapist. And remember, you are the client, they're working for you. So if it's not working, stop wasting your time and your money and find someone who you actually do feel like you can click with, and that's okay to end it and be like, I'm going to find someone else. But it does take time and money to do that. So really using that phone consultation time to feel them out, ask them some questions, hear some things that you might want to ask them. I know a lot of people might think, oh, I want to find a therapist who's in the church, who has the same views and background as me, because then I don't have to explain it and they're going to understand me. I would say that that's a common misconception, because actually, as a therapist, we're trained to be able to work with any background, any different faith background, because we know that the therapist relationship isn't about me, it's about you and your goals. So if I were to meet with a new client, I wouldn't say, oh, they say they're Muslim, okay, I know that means they believe these things. It's actually about me asking you questions to explain what is your faith, so that I can help you and support you better. So working with someone that you feel like you can connect with and be honest with is more important than their experience of working with your specific background. I don't feel like I did the best job of explaining that, but the main gist is that it's that trust relationship. And sometimes when we work with someone who we think has the same background as us, it actually might backfire, where maybe we think we believe the same things, but there are little tiny things that we might feel that are different. And so it's nice to have a fresh, clean slate to be able to explain what you believe and what your goals are to someone. You can ask, there are faith-based counselors. There are counselors who advertise. I work with different religions, and that is something I incorporate in my practice. And if that's important to you, then that's definitely something that you should look for. Also, multicultural backgrounds, if they have experience working with your particular background or speak your native language, that can be helpful. Looking at specialties, for example, a lot of counselors might not have experience working with eating disorders. So trying to find someone who really fits with what you're looking for. Maybe you have a preference for male, female, or age. You want someone older than you or younger than you. And by you, I'm saying you, but I'm talking about how you can guide and help those that you work with to find someone. And it's really important that if you're doing couples counseling or family counseling, that everybody feels comfortable with the person that you are working with. I know someone talked about stigma, and when we look at barriers to mental health services, there's a long list. This is just a couple of examples, but there's a lot of reasons why we don't access health services, mental health services, in the same way that we do physical health services. It's a lot more, it can feel a lot more shameful or negative to feel like I need to get help for my emotions. Why can't I control my emotions? Medication is a crutch. I don't want to be dependent on medication. Beliefs that mental illness might just be a spiritual problem instead of seeing it as maybe both spiritual, physical, emotional, and that there are specific tools that can help, and aside from prayer. Also, that mental illness is not a real thing. It's just kind of a phase we're going through, and we just need to shake ourselves out of it. And that, prayer and conditions, if I do enough of those, it should change the situation, right? And sometimes that's not the case. And we know that there are both physical and genetic, like people are predispositioned to some conditions more than others. And so there's a lot of factors that go into mental illness. And so just being willing to explore different approaches to help ourselves, trying more than one thing, can help us. Also, the costs are huge. I mean, if anybody's tried to pay for therapy out of pocket, you know that it ranges, but it can be extremely expensive. And that can be a barrier. It's hard to justify sometimes. If we're not in physical pain, why should I pay all this money? And I'll share from personal experience that I wanted to see a couples counselor that wasn't covered one time when I was in crisis. And it was, I think, around, $130, $140 for each session. And that can be a hard pill to swallow, but I knew that I was in crisis. And so if I didn't, that my relationship was, not doing well. And so helping to kind of explore that with the families you're working with and couples, and know, like, we would dish out a couple $1,000s if we had, a major surgery that we had to do. Can we do that for our relationships and our emotions and our feelings, so that we can we justify that and take care of that for ourselves, so that we can feel that much better about our life and more excited. Also, just the lack of knowledge of where to go and how to get that help. So I did want to just touch upon this first, because I I know I just maybe scared some of you by telling you how much insurance costs, but also there are ways to work with your health insurance, because a lot of health insurances cover mental health, or they at least pay for portions of it. You do need to check with your insurance, and this can sometimes mean just calling on the back of the card. Also, some employees, they do offer benefits and resource programs that include some sessions. Like I know I work for a school district, and they offer 3 sessions per employee every school year. So you never know, just looking into that and calling around, asking what's covered. Again, we talked about how the first point of referral is oftentimes the doctor, a medical doctor. And sometimes you won't be seen by a therapist with your insurance until you have a diagnosis from a doctor. So that's why when I work with families, I really encourage them to go to the doctor, tell the doctor that they're having these symptoms: trouble sleeping, increased irritability, thoughts of self-harm. And that way the doctor will know, okay, I should screen for depression or anxiety or something else. So sometimes you do have to have a diagnosis to be treated. That's just how the medical model works in the United States. So just calling your insurance, helping the families you work with know where to go. I'm going to go back one slide. So this is, I think, what this group can really do to help reduce the stigma and also support those you work with. Just normalizing counseling and therapy, just talking about it as easily as we talk about the doctor or going and getting a chiropractic appointment or whatever that may be. That there's times in our life when we need more help. There's times in our life when we don't feel well. We go to the doctor, we go to the therapist, and then we feel better and we can stop. Talking about our own mental challenges, our own experiences with therapy can help destigmatize. And then also really knowing what your local resources are for families. So I worked when I was interning and in grad school. Our community, or my university, had a free clinic. So we would accept anyone for counseling because we were trainees, right? So if someone doesn't have insurance or it's not covered, there are local resources within your community that might have free or low cost sliding scale counseling services. So just trying to do some research on what is in your community, what organizations and what is available, so that when someone is asking you for a referral, you can let them know, hey, you could try this place, you could try this place. Learning just the different resources in your community that are going to help with crisis. The women's shelter, right? We talked about domestic abuse and violence, and in that situation, knowing where to send someone. Child abuse, knowing the hotlines to call if you need to make a report. Crisis hotlines for there's a national crisis hotline that anyone can call at any time of the day when they need someone to talk to. And so, and I have that on here as well. I recommend you try calling it and seeing. I called the other day just to see what it's about and ask some questions. And it was a really, really good experience. Bringing outside agencies to present. Sorry, I didn't finish that sentence, but to present at your events and church, and just putting up posters and signs in the church or what buildings that you use to just raise awareness that this is a safe place to talk about mental health. I'm realizing that we are really toward the end of the time, and I wanted to make time for questions. So I think I'm towards the end here. I think there's something called a warm handoff, which is where, sometimes when we are in crisis or we are just needing more help, picking up that phone and calling and making an appointment is really hard to do. And so being someone that says, hey, come, I'll help you, we'll call together. Let me help make the call for you, or we can do it together so you don't have to feel alone. And let's go over your questions that you want to ask together, and doing that for someone can be really helpful. And then just continuing to show support and be there, even as they might need more help. Just continue to remind them and support them and pray for them. Here's the 24-hour crisis line. There's also text lines for, especially I know my middle schoolers, they love to text instead of talk on the phone. So these are some lines, I know at least for California, but I think the first one is national. And so that was a lot of information. We only have a couple of minutes left. I see in the chat someone asked about mental health first aid training. And yes, there is a program that does that. And I think that would be so great for all of, especially the those of you that work with young people. SAMHSA, someone mentioned, is a really good resource. Also, the National Institute of Mental Health, the National Alliance of Mental Health, they have websites where there's a lot of posters and educational videos that you can watch. So down to the last couple of minutes, but are there any questions that I didn't answer? Anybody?
One question that I got directly, how can we help people with mental health in the matching process?
Oh, in the matching process. I think like we talked about earlier, you know, in the principle, they talk about individual perfection first, right? And I think this is kind of that piece. If you, you know, if you know that you have a mental illness or you suspect you do, then working on that while you know, making sure you feel like you're able to manage that well, and that you have the support. And that's gonna help you, I think, feel more comfortable, more confident going into the matching process. And, you know, it doesn't mean, you know, like we said, 1 in 5. So there's a lot of people, you know, a lot of people that have successfully and, you know, manage a mental health illness and their relationship. And I think just reaching out and getting more help and more awareness of yourself by doing individual therapy and making that your goal. You can even meet with a therapist and say, my goal is I really want to be a great partner. And I know that my moods get in the way of that. So I want to work on my mood so that I can really be there and available for my future wife or my future husband. And that I'm not going to, I want to work on this, you know, trauma that I have so that I don't lash out at my wife when I'm mad, or, you know, I know that this comes from this place when I was younger and I want to work on that. So I don't know if that answers. Also, you know, substance use disorders and alcohol use disorders. If someone is using alcohol or some type of drugs to cope with negative feelings and not able to function, then that is another reason to go to work on yourself before you, so that you can really be present and your best self for your partner. You know, it's all related.
Awesome answer. Since they're not closing the room, I think we can just go ahead and take up as much time as we need. The last question that I got was, is there a place to look up psychiatrists and counselors within the faith?
That wouldn't be something I would know. I know Yena's here, maybe she might know. I think the problem is with the limitations. There's just, you know, there's a shortage of psychiatrists, period, in this country. So trying to work with, you know, I just wonder when I hear that, I wonder what is the concern about why we want to work with someone in the church, you know, within the unification movement versus, you know, maybe somebody in your community, in your local area. But Yena, do you know, is there a directory or?
Yeah, we have one link, but I just want to echo what Wendy shared. That's one of the reasons we wanted her to share about this topic and invited, because we don't have that many, and it's so important there's so much more we don't know and understand and have an ability to reach out and get support. But I'm going to put in the chat the resource we do have on the BFM website.
Yeah, and like I said, it's about the fit too. And so, you know, finding someone that you connect with, you can share everything about the church and your experiences and what is important to you and why, and that you are committed to this blessing and you want to work through this. And if they're a good therapist, they are going to support you and they're going to work from that framework that you give them to help you. And so I just don't want us to feel limited to, you know, because it's also nice to sometimes, when we do get to go back in person, to have that space in your community. So to actually get to meet with someone. Yes, employee assistance programs. That is what I have through my school district. And so I think I get like 3 sessions a year, which through that. And so it's good to remind people to check that out, ask their local, their employer what is covered, because you might have programs that cover that.
Thank you so much for your time today. Really awesome information, helpful resources.